Assalamu alaikum, my lovely nurses. I hope you are fine and your family is good. So today our topic is ethical principles. Ethical principles. So which ethical principles we are using in our regular the nursing routine, in our regular duty? We are using some ethical principles. So there are some types of ethical principles. Number one is autonomy. Number two is non-maleficence. Number three is beneficence. Number four is justice. Number five, veracity. Number six, fidelity. These are ethical principles that we are using in our regular nursing care and regular our routine wise we are using these ethical principles. So we will discuss one by one. What is autonomy, what is non-maleficence, beneficence, justice, veracity and fidelity. So we will discuss one by one. So first we will discuss autonomy. What is autonomy? The respect for an individual rights. Respect of an individual right to self-determination, and making one's own decision, that is autonomy. For example, we have to give respect to the patient for their self-determination and he has right to make his own decision. For example, which type of decisions? Make informed decision about their care, choose or refuse treatment, patient have right to choose the care and refuse the treatment, control on their own body and health, make decision for operation like the written consent, that is also the right of the patient. We have to give respect, either he will refuse or either he will accept the procedure, that is patient right. Express their own values, and preference, what patient like, what he doesn't like, that is the right of the patient to express his feelings. Make decisions without any manipulation, they have right to make the decision without any threat, without any manipulation. Patient have right to make the decision. So that is autonomy. Second is non-maleficence. So non-maleficence means do not harm or cause no harm. Non-maleficence mean avoiding harm or injury to the patient, preventing harm from treatment or intervention, minimizing risk and side effects, and side effects. Avoiding unnecessary tests or procedure. Unnecessary tests or procedure. Disclosing potential risk and benefits to patient. Disclosing potential risks and benefits to patient. So, avoiding harm or injury to the patients during your duty, this is our responsibility. We will avoid to make harm or injure to the patient. This is our responsibility. We will, when we are providing treatment or any intervention, we have to we have to prevent the patient from the harm. We minimizing the risk and side effects. So we have any procedure, anything we are doing to proceed, so we have to check first what's the risk and the side effects is there. So we have to discuss with each other, then we have to proceed. So minimizing risk and side effects, proper communication, very important. Avoiding unnecessary test or procedure. So no need at the test or procedure, that is no need for the patient to make the diagnose, no need to do. Disclosing potential risk and benefit to the patient. For example, if doctor is doing any surgery, any procedure, this is our responsibility. We will explain everything to the patient, what is the potential risk and what is the benefit of the procedure. This is the patient right. So that is non-maleficence. The next is beneficence. So beneficence, you can see from the word benefit. Beneficence, give good to the patient. So the duty to do good, the duty to do good to others and maintain a balance between benefit and harm. So this is beneficence, the duty to do good to the others. Try to do this is, as a nurse, this is our responsibility to be a good with the patient and maintain a balance between benefits and the harm. So always try your best to give benefits to the patient. Like from the word you can understand, the beneficence is referred to the principle of doing good and promoting the well-being and flourishing for the patient. So always try to do good and promote well-being for the patients. What we can include, like acting in the best interest of patient. Acting in the best interest of patient. Providing high quality evidence-based care. Provide high quality evidence-based care. Relieving suffering and pain. For example, if patient is in the pain, this is our right. We will talk with the primary healthcare provider to give the order the medication. So give painkillers to the patient, so he will relieve from the pain. So relieving suffering and pain. Empathizing with patient and their families. With patient and family. So our attitude, our behavior should be good with the patient and the families. Advocating for patient needs and rights. For needs and rights. So we have to work as an advocate. We advocate the patient for their needs and for their rights. Improve patient outcome, enhance quality of life, support patient-centered care, promote a culture of compassion and empathy. Mean always respect the culture of the patient. Always do your work according to the culture of the patient. If patient tell no, this is not good, this is not included in my culture, I don't want to proceed this one. So what is our right? We will respect the patient culture, and yes, what we can do, we can explain the patient about their procedure, about the benefit, what benefit will be there if we will proceed your surgery or proceed this one. We will give you this medication. If we will do this test, what benefit you have to take. So explain, explore the your give education to the patient, explain to the patient, but at the end this is our responsibility to respect the patient culture. So this is beneficence. Always do good with the others and to maintain a balance between benefit and harm. The next is justice. So what is justice? In the justice word you can understand that justice is fairness and equity. Fairness and equity. So mean ensuring fair distribution of resources. Fair distribution of resources mean we have to fair with all patients, equal and fairness with every patient. This is our responsibility to make a justice in between the patients. So ensuring fair distribution of resources, for example, the access of care is not like this, the one patient is getting everything but the other patient have no any access to the care. So access for the care for every patient equal. Allocation for organs, allocation of organs. Transplantation. For example, the two patient need there is two patient for the transplantation, like kidney transplantation. So you give both patients a equity and fairness. It's not like this, give one patient a full your empathy and full everything, he is getting good but the other patient is getting nothing. So you should have to fair with both patients. Assignment of healthcare providers. For example, you are working as a charge nurse. So 4 nurses are working under you. You are the supervisor, you are a charge nurse, but you give too much work to one nurse but the other nurses are taking less work. So this is not the fairness. Always fair with the all nurses. Ensuring fair process and procedures like informed consent, respect for patient autonomy, addresses the health disparities and promoting health equity, including access to care for vulnerable population, promoting fairness in equity, respect patient rights. So this is all included in the justice. Fairness and equity, always fair with the all patients, always fair with the all nursing staff, always fair with the all workers that are working under you. So this is our responsibility to create this environment to fairness and equity with everyone. Now the next is veracity. Veracity means truthfulness and honesty. Truthfulness and honesty. What's the meaning of truthfulness and honesty? The truthfulness, honesty mean always tell the truth to the patient. This is very important. The obligation to tell the truth and communicate truthfully with the patient. Accurate diagnosis and prognosis. Never tell lie to the patient. Always give full information. That is the right of the patient. He knows his diagnosis and prognosis. So accurate diagnose and prognosis. Clear communication of treatment, options and risk. Transparent disclosure of medical errors or adverse events. For example, if you make a mistake, you want to give, for example, you give wrong medication, this is our right to inform the patient. Always tell the truth to the patient, never hide anything. So transparent disclosure. Transparent disclosure. honest discussion of patient, honest discussion of patient prognosis and end of life care. If patient have less prognosis of the disease, we have to tell everything to the patients. End of life care, truthful representation of medical research and findings, truthfulness representation. For example, if you are making the lecture, don't cheat with anyone. Truthfulness representation of medical research and findings. If this is your research, this is your research. Don't take the other person research and tell, no, this I am the one who make this one. So this is wrong. Always show your truthfulness to your colleagues, your staff, your all team members, and especially for the patient. The last is fidelity. What is fidelity? The duty to do what one has promised. One has promised. We can tell faithfulness, to maintain loyalty, and commitment to the client. To be faithful to agreements and responsibilities one has undertaken, and to do no wrong to the client. Mean the fidelity mean the faithfulness. Always be loyal and faithful with your profession. Always, if for example, if you tell to the patient, you check vital signs, and you are, for example, you check vital signs, and then you tell the patient, I will come after 30 minutes, but after 30 minutes you are busy somewhere. But always faithful with your with your profession. If you are busy, send some other nurse or go to him, sir, I am little busy, I will come after some time. So be loyal, be faithful with your duty, and this is our responsibility. To whatever we make promise with the patient, we have to maintain the loyalty and commitment to the patient, to be faithful agreements and responsibilities one has undertaken. If your charge nurse give you responsibility, that is your responsibility, so you should have to do it. Don't tell, no, that is the other he make this one, he make this mistake. So don't blame to the others. To be faithful with your work and fulfill your work by self, because this is your responsibility. So the fidelity mean be loyal, be faithful with your profession, fulfill the promises that you make with the patient. This is very important in our profession. So this is the ethical principles: autonomy, non-maleficence, beneficence, justice, veracity, fidelity. Mostly questions are coming in the exam related to this topic. So this is very important. I hope you like the lecture. If you like, please share and subscribe my channel, and don't forget to push the bell button so you can receive my coming videos notification. Thank you very much. Allah Hafiz.